Nargis speaks about living with hepatitis delta. The hepatitis D or delta virus is a sub-virus of hepatitis B that depends on the hepatitis B virus to survive and reproduce. Hepatitis D affects between 5% and 10% of people living with hepatitis B, and can quickly progress to a more serious and advanced liver disease than HBV alone. Today we will share with you a story of a hepatitis B and D co-infected patient who shared her story with Hepatitis B Foundation about her lifestyle and experiences. Ariana, an intern at the Hepatitis B Foundation, interviewed Nargis. Nargis is a resident of New York, USA who is living with both hepatitis B and D infection. Shared about her experiences from diagnosis to management. So, let's go to start her interview now.
Hi Nargis, thank you very much for joining today. When were you initially diagnosed with hepatitis delta infection?
I was diagnosed in 2005. I did my blood work at the end of 2005 and got my result at the beginning of 2006. The reason why I went to do the blood work is because I had very severe flu-like symptoms.
How did you know you were living with hepatitis delta virus?
I was out of the city for a trip and felt sick after, so I immediately returned to the city and did blood work and found that it's hepatitis D. I was surprised because I know if you don't have hepatitis B, hepatitis D would never exist in your body.
How did you initially feel about it?
To be honest, I was depressed. It happened during the best time of my life when my career was at a high point, and I'm feeling like I'm enjoying life and everything is fine. All the difficulties in my life were gone. During that time, I was at the top of the level of my career and I could do something for myself and for my family. I had big plans, and when I was diagnosed with hepatitis B, all my plans just collapsed. My doctor just straight up told me that I'm lucky to have hepatitis B and D, not C. They did not give me any kind of psychological support, and I was extremely depressed. I would say, thank God for my family and my husband for being there to support me always. I'm originally from Dushanbe, Tajikistan. It's a small country in Central Asia. Unfortunately, we don't have enough good medicine to help with this kind of thing, as the government is not supporting nor providing any kind of medication. The medication I needed had to be ordered from Russia to bring here, and was very expensive. The prices go up and down. And this one is also not guaranteed to work. I got interferon, but it didn't work for me. After 1 month of injections, I got very, very sick. And the doctor told to stop it.
How do you think this disease has impacted your physical state?
Mostly it's the mental changes when you are becoming depressed, but when you're starting the treatment, you feel so weak. I had severe weakness, fatigue. I also had GI or gastrointestinal problems as well. I get kind of the nausea, no vomiting, just the nauseous feeling. But in the morning, you are feeling fatigued. You are always the one to sleep and have joint pain. Now I'm just feeling kind of the joint pain, but when I'm starting to work or do some activity, I get tired. I always feel the fatigue, or the fatigue sometimes is so much, I don't want to even do anything, but I always push to do things I should do. I often get bad pain. But I'm always appreciative, as I am still alive, and I have to thank my family for that. I have 4 kids and they all are vaccinated as well, so that's why they are totally safe from this dangerous disease. I have changed my routine in life, and doing job are like keeping me in the life, making me happy, and I'm not thinking so much about my hepatitis. Thank God, I have my arms, legs, and I can eat, can walk, and can see this beautiful world. This is more than enough to keep me happy.
Why is raising awareness of hepatitis delta important?
I didn't catch it from receiving medical care in my country, but a lot of people don't know about this one, and, if you don't know, you don't pay attention. We must be careful with needles, donated blood, sex without condoms. These can possibly transmit hepatitis delta to anyone. It is important to make information booklets, allowing patients to talk about their experiences, finding people similar to us, and we are people, we still have this disease, but we are very active, we can work, we can sing, do something good.
What do you wish more people knew about this disease?
It's hard to always be healthy. I wish for everybody to be healthy, but it's now hard to be healthy, because you never know where you can catch hepatitis or any deadly viral infection. I can wish for people to keep their eyes open and not be afraid. Keep your eyes open. Where are you going? What are you eating? Which kind of medical offices are you going to? If you have the blood transfusion, using the needles or something, or some kind of tools used for dental procedures, just to make sure all of them, they're sterilized and clean. What resources do you think you would have wanted initially when you got diagnosed with hepatitis delta? Getting the right medication for people is very important. Insurance companies should help the patient to get the right medication also. I've been in a research study, and the first research study I got is a medication for hepatitis B and D. The doctor teams are working specifically with this kind of patient when the patient goes to the hospital and does the blood work to see the level of the hepatitis B and D and also the liver enzymes. Hepatitis patients are often get depressed and always need some support group. Maybe some social workers can closely work with people who have hepatitis B and D.
Do you think there's anything else you would like to share about your experience?
I would like to tell the people who have hepatitis B and D, do not be afraid. The doctors are working, and the research team is working hard. We're not alone in this world. Health Wisdom and many others organizations are working on this problem. Do not lose your hope. Be powerful, be happy, thank God we are alive, and support each other.
This is really awesome. Thank you so much for sharing your insight and experiences with us today.
You must welcome. I would like to say thanks to all of you guys who are watching this video.
If you like this video, please like and share this video more and more. Please support our channel. Thanks for watching Great Wisdom Discover. We will meet you with new update in the next video. Thanks for watching Health Wisdom.